Health and safety at work. Introduction to the module. You must maintain health and safety at any workplace with utmost importance. A handy person is more likely to face health hazards since it deals with risky work. In this module, you will learn about the safety measures and protocols for maintaining safety at the workplace. Topics to be covered. Managing health and safety at work. The importance of health and safety in the workplace. Health and safety policies. Conducting risk assessments. Accident prevention. Health and safety training. Avoiding accidents. Fire safety. First aid at work. Safe practices at work. Asbestos awareness. Managing health and safety at work. The Health and Safety Executive, HSE, is the government agency that operates in the UK and is responsible for regulating health and safety in all workplaces. The HSE estimates that a yearly average of around 500 people die in the workplace and that several hundred thousand suffer minor injuries or sickness in their jobs. These injuries and fatalities are also estimated by the group to cost businesses over £4 billion in total each year for time lost and expenses paid. The need to protect a workforce from unnecessary harm in any organization is not just a moral obligation, it also makes sense from a business perspective. To ensure this is given the proper attention, these rules apply. Every single individual in an organization must take some ownership for monitoring and highlighting any potential hazard to colleagues. But management holds the responsibility for maintaining a high standard of health and safety, as stated in UK legislation, the Health and Safety at Work etc. Act in 1974, and other laws. These UK laws continually emphasize that detection and mitigation of work hazards must lie with the relevant managers of an organization. The importance of health and safety in the workplace. Understanding why health and safety are so important is easy on a practical and emotional scale. On a purely human level, most people will want to prevent suffering rather than concentrate on profit and productivity. In pure and simple terms, the act of managing health and safety involves integrating effective health and safety policies, identifying hazards to employees, assessing the risks of harm from hazards, controlling regular health and safety, ensure the health of employees, stress management, accident prevention, measuring health and safety statistics, communicating good health and safety protocol. Health and safety policies. Well-organized and documented health and safety policies are evidence of how much the management of an organization cares about its staff. So, it must be presented in a certain way as an official document. All health and safety policies should contain at least 3 sections. A general policy statement. A description of how and when the policy will be applied. Details of arrangements for implementing the policy and how employees are required to act. The general policy statement is a simple statement from the employer, stating their intent for protecting the employees. Conducting risk assessments. A risk assessment is the investigation of risks and the resulting analysis of hazards. A hazard is any object, place, or situation that can cause harm. Examples include working on tall buildings, transporting dangerous chemicals, etc. A risk is the chance or the possibility of a hazard causing harm. Examples include the probability of falling from a building without restraints, leaks occurring during the transportation of chemicals, etc. The main objective of a risk assessment is to mitigate any risk as much as possible, leaving employees safe from harm. Risk assessments must be formally actioned in an organization if there are more than 5 people employed. 2 types of risk assessment exist. Quantitative risk assessment, this is based on information taken directly from the site of the risk. Qualitative risk assessment, this is based on generalized data and doesn't use information from the risk site itself. The HSE advises specific scenarios where accidents and high risks are more likely. These include situations like receiving and stacking materials, multiple people and materials in transit, maintenance work on a property, processing noxious materials, Using machinery and using large amounts of electricity. Employees not wearing PPE, personal protective equipment. Emergencies, fires, floods, explosions, etc. Long-term injuries from strain. When these risks are identified, they should be rated for severity and impact. The HSE recommends ratings such as catastrophic, there is an immediate danger of death and illness on a large scale. Critical, the hazard could cause severe injury, illness, and significant damage to property or equipment damage. Marginal, the hazard could result in illness, injury, or property, but this is expected to be of minor impact. Negligible, the hazard will not cause any severe injuries, with only minor first aid cases resulting from it at worst. When those factors have been measured, management must then satisfy 3 questions as part of the assessment. What is the worst result of an accident? How likely is it that something could happen? How many people could be hurt if an accident occurs? The probability of an accident occurring should also be measured in ratings, running from probable to extremely remote. For an organization to mitigate the risk from a hazard, 6 actions can be taken. Hazard elimination, remove the source. Substitution, use something less dangerous. Use of barriers, surround the hazard with protection. Use of procedures, limit the time of risk. Use of warning systems, make the risk visible. Use of personal protective clothing, wear appropriate PPE. Accident prevention. Proper prevention of accidents can only occur when potential accident scenarios are identified. Practical safety factors are incorporated at the design stage of property and equipment. PPE is provided. Regular risk assessments are carried out. Previous accidents are thoroughly investigated and followed by corrective actions. Records and statistics for accidents are maintained. Regular health and safety training occurs. Management lead by example. Unrealistic demands are not placed on employees. Health and safety training. Training programs for health and safety protocols should be an essential part of an organization's infrastructure. Training should be introduced, along with the policies, as part of the onboarding process or induction course for new employees. Additional teaching should be provided when employees transfer to new work areas or roles. Extra learning should be provided when there are significant changes in the work environment. Refresher courses are also advised at regular intervals to ensure that staff remain aware of all protocols. Fire safety. Potentially dangerous ignition sources. Flammable substances and oxygen interact all the time, but with ignition, they become dangerous. Ignition sources range from the obvious to the ignored and can include naked flames, candles, gas cookers, lamps or lanterns, embers or ash, fireplace remains, discarded cigarettes. Electrical equipment, especially if it is faulty. Overheating and sparking are common in faulty electronics. Friction in equipment, loose bearings or insufficiently lubricated joints in machinery. Potentially dangerous fuel sources. Any flammable substance that could potentially keep a fire going is considered fuel. Some examples include paper and cardboard. Plastics, the thinner the individual pieces, often the more explosive they become. Wood, of all kinds, including composites such as chipboard, balsa wood, and MDF. Fabrics, very few fabrics are flame retardant, and they are labeled as such. Rubber. Foam. Flammable liquids, paints, varnishes. Flammable gases, natural gas, petrol vapors. Aerosol products, air freshener, deodorant or antiperspirant. Electrical fires. These are fires caused by incorrectly functioning electronic equipment. This can include plugs or extension leads bearing too much power load. Equipment short-circuiting causing spark discharges. Overheating or faulty or incorrectly installed or misused equipment. Broken or damaged or poorly aged wiring or cables. Equipment that has not been repaired or maintained correctly. When dealing with electrical fires, the first step is always to isolate the power supply. Failing to do this could restart the fire. Employer duties. The following measures should be taken to prevent fire accidents. Keeping fire safety equipment, alarms, hoses, emergency lights etc., in good working order. Creating a fire plan and organizing evacuation procedures. Providing all staff with fire safety training. Advising all staff of potential fire safety risks. Keeping a fire risk assessment up to date. Have the procedures for fire safety properly recorded for inspection and safety purposes. First aid at work. The natural reaction to any workplace injury is to contact emergency services immediately. But, wherever you are at your workplace, realistically, there will be a significant delay until the medical officials are on site when an accident or injury occurs, unless it's a hospital. Depending on the severity of the injury, the application of first aid at work can have many benefits, and in severe cases, can even save a life. Some people may be intimidated by the idea of influencing the health of a colleague or stranger. But it's not about becoming a trained doctor or nurse. It's about providing assistance and comfort to those in need. Consider these potential simple benefits when applying first aid at work on an injured colleague. Alleviates pain and anxiety. Prevents further damage and infection to the body. Stops significant blood loss and life-threatening wounds from getting worse. Promotes recovery. Gives emotional support and assurance to the patient. Preserves life. Teaches life skills and abilities that can be used outside of the workplace and maybe even with members of your own family. Safe practices at work. Some immediate safe practices should be applied and followed at every premise with employees present. At the bare minimum, these should include a first aid box or medical kit being immediately available for use. At least one person in charge of contacting medical emergency services during an incident. At least one person assigned as a trained first aider to be present during work hours. Of course, the size and number of these precautions should be appropriate for each workplace and the risks on the premises. Ideally, some form of assessment should take place to confirm the best options. Asbestos awareness. Asbestos awareness training is required to be given to employees whose work could foreseeably expose them to asbestos. What is asbestos? Asbestos is a naturally occurring rock that is or has been mined. Asbestos is a generic term for a group of fibrous mineral silicates. Formed over millions of years, crystallized under the influence of igneous activity. Types of activities likely to increase exposure. Cutting, especially with power saw. Drilling. Hammering. Sanding. Stripping. Duty to manage asbestos. Main requirements. Identify or presume asbestos. Assess the risk, location or condition. Make and keep an up-to-date record. Prepare an action plan that sets out how you are going to manage the risk of asbestos. Setting up a system for providing information on the location and condition of the ACM. Review or monitor, is the management effective? Summary. This module can be summarized as: the main objective of a risk assessment is to mitigate any risk as much as possible, leaving employees safe from harm. Training programs for health and safety protocols should be an essential part of an organization's infrastructure. Electrical fires are fires caused by incorrectly functioning electronic equipment. Depending on the severity of the injury, the application of first aid at work can have many benefits, and in severe cases, can even save a life. Asbestos awareness training is required to be given to employees whose work could foreseeably expose them to asbestos.